Greetings all, and some good news today, for a change perhaps. It's Ireland focus, but please bear with me and please do help share this to your Irish networks and friends and family, to avail of a super event that we're organising. So it's June the 11th in Ashford, County Wicklow, beautiful historic area around half an hour south of Dublin, and we're going to be doing insulin testing. So meetarbolic.org, our new company, in the last few years have developed on-the-spot insulin testing that give results pretty much immediately. So incredible technology that's going to be game-changing. And we have the CEO, who's also a GP, who's going to be likely visiting or sending someone to do the testing, but also two superb doctors, one from the UK, though Irish originally, Dr. Donal Collins, and also Dr. Alan Farrell, who's worked with the sports unions, and he's massively into metabolic testing for health, insulin resistance, and avoiding chronic disease. So super stuff. So I'm going to go through on the day, first thing, the Krafts tests, and I'm going to give a quick flavor here. The Krafts insulin assays. So here we go. Okay, let's do a quick run through of the Krafts test and its amazing significance. So here's Dr. Joseph R. Krafts. He has an incredible CV, and in the 70s he did groundbreaking work in insulin measuring using the new Pharmacia assay. So he took that technology, he was senior in his hospital, and he got access to low-cost testing. And like an incredible problem solver, they're a rare variety, he went ahead and used that technology and found out something that was so profound. So anyway, I discovered Joseph Krafts' work in 2015 and I flew from Ireland. He was still alive, 94. And Dr. Jeff Gerber, my co-author, flew from Denver to Chicago, and his son got a suite and I interviewed him. And it's a timeless interview of massive importance, and I'll put the link below. So, based upon his several thousand autopsy examinations, the pathology of diabetes is vascular. And this is very important. Diabetes is essentially a vascular disease. So it's no surprise that it's intimately involved in most cases of cardiovascular disease. And that was one of the points he was stressing. And he did thousands of autopsies. This guy was a machine for that stuff. Incredible man. So he also made a statement in his book: those with cardiovascular disease not identified with diabetes are simply undiagnosed. Now, this is a profound and far-reaching statement. In other words, if you have cardiovascular disease, but you're apparently not a type 2 diabetic, you simply haven't been tested properly. Now, I think it's fair to say this is not exclusively true, but it's overwhelmingly in general true. And most doctors will have no idea of this, sadly. Krafts test, he was doing 5-hour insulin assays, basically an oral glucose tolerance test where they measured the glucose for a couple of hours, but crucially he was measuring the insulin. And I always tell people, you got to measure the right variables if you're going to actually decode and solve the problem. And insulin is that decoder. So it's like measuring an aircraft engine on full rev when you do this. You get the proper response as to whether there's an issue. But if you just measure fasting glucose, fasting insulin is better, but fasting glucose, you don't see the engine running, so you miss most of it. So he got a quarter of his people were pattern 1 healthy, and he began to notice this pattern kept occurring in around 1 in 4. He didn't yet know the significance, but later he decoded it. And around 3/4 were getting these unusual patterns, and they were quite distinct brackets. And he saw the patterns and realized there's something huge going on here, and worked it out. But these people, around 3/4 of his 15,000 tests, 5-hour tests, these people had diabetes in situ. He named it diabetes in situ. They were certainly diabetic with these responses, but none of them were diagnosed. So diabetes in situ, undiagnosed diabetes. And he did over 14,000 people, as I mentioned, and the fasting glucose showed up nearly none of these people. And even the oral glucose tolerance test, which is a better test, showed up, less than half of these people. So the insulin was king. It's king of the heap. The earliest laboratory diagnosis for diabetes, as he stated, and that's, I think, the name of one of his papers he published, quite a few papers at the time. So there you go. You could tell 10 or 15, maybe 20 years in advance by getting insulin testing that you're going to get a diagnosis of type 2 diabetes and the associated heart attacks down the road. So this is huge. It's the early warning that allows you to intervene, and you can actually fix these curves relatively easily. Now, you might have to give up some foods which are kind of addictive, so I'm not saying it's trivial, but we have examples of fixing these curves that are stunning. And here's one. And you can see there that the red is the original. A few months later, just giving up bread and beer and cutting out the carbohydrates, and you can see the enormous drop in the insulin curves. So stunning results are possible with this insulin testing methodology and technology. So that's a quick run through of Kraft and the importance of insulin, but I'm going to finish with a couple of papers I like. They represent the canon of science on this. These are just good exemplars. And here we had a study of patients with a myocardial infarction or heart attack, and they tracked them for 7 years to see, well, who gets a second heart attack and what blood markers predict the second heart attack. What's important? So, like in so many published papers, the total cholesterol and even the high bad cholesterol didn't predict anything. No statistical significance, no good, sadly. The high blood pressure had a double risk of the second heart attack. So it was a pretty good indicator. And we know blood pressure is a good indicator of future problems. But you got to remember, most idiopathic or essential hypertension, that's an epidemic in the West for the last half century, most of it relates to sodium retention in the kidneys and relates to insulin resistance. So it's kind of a proxy for something else. And what about high insulin? High insulin in the men, did it predict a second heart attack better? Well, yeah, 7 times more likely, approximately, highly statistically significant, of predicting a second heart attack. So you can see who's king of the heap here, right? And that's why we are trying to bring insulin testing to the masses to basically let people know what's waiting down the road for them if they don't change their lifestyle and diet, mainly. Some cases may require more medications, genetic issues, etc., susceptibilities, as Arthur Agatston will go through in his talk on June the 11th in detail, but generally this is the problem for most people. So, Eurospar, final thing I'll show here, it's crucial, and 2015, same year I interviewed Joe in Chicago, Eurospar came out, and this study should have been done decades before, but anyway. They surveyed all coronary disease patients, or a subsample of all of them across Europe, ages 18 to 80. They cover the age ranges, 24 European countries. So no genetic variation left unturned. So they did an engineering scan and covered everything to see what is crucial in coronary disease. What did they find? Well, straight away from the records of these thousands of people, they saw that around a third were already full-blown type 2 diabetics, which was kind of shocking how big that slice was. But more shocking to them was another quarter were clearly type 2 diabetic full-blown, but they just hadn't been diagnosed, as Krafts said. Another quarter they called high risk for diabetes, almost a little embarrassed. But they were type 2 diabetic. You could see from their glucose. They just didn't meet the threshold. And glucose diagnoses too late. And of course, they didn't measure the remainder with insulin, or any of them. So we know from Kraft that they're going to find a whole bunch more in the remainder. So over 3/4 of all the coronary disease patients in Europe, right, are essentially type 2 diabetic. So this is the center of the coronary disease universe. And with insulin testing, you can find out way in advance. And we know how you intervene to resolve your curves. In which case, you pull yourself back out of the risk of type 2 diabetes, coronary disease, etc. Not magic. I mean, you can't eliminate disease. But the thing is, you can put yourself right back in a low risk category. And you can do it fairly easily. So that's what June the 11th is all about. So again, please tell your Irish networks, friends and family, we got the real guys down at this event, and we can help explain all of this in layperson's terms and give them the testing that you really need. And put you on the road to recovery and reducing a risk for terrible, debilitating or life removing diseases down the road. Undiagnosed type 2 diabetes, that's the theme we're talking about here. As well as the insulin testing there, which is pivotal, we'll also have Redicare Limited, an Irish corporation that has apps for real food, for health and avoidance of chronic disease, and they work with corporations and corporates in Ireland and also pharmacists to arrange testing for employees, etc. And we're going to have them do the lipid testing. Now I know, you'll say, oh, cholesterol is not the big thing, yada yada. That's true. However, the triglyceride HDL ratios, the total cholesterol to HDL ratio, and the triglyceride number itself have a lot of value when added to the insulin testing and glucose testing. So we're striving to keep the cost to an absolute minimum for testing only, around $50 or so. And we have people flying in from the UK, Dr. Collins and his assistant, and from Europe as well. And, it's quite a bit of cost involved, but we're hoping we get good numbers. It's a fantastic offer. And also for a bit more, you can stay for the whole day for the talks. And I'm going to give overviews of the science of insulin and its importance in chronic disease in a detailed version, probably around 10 minutes or so, for the layperson, of the Krafts testing and the importance of it, and even fasting insulin and HOMA calculations, and explain how important this metabolic testing is, and hugely more relevant than a lot of the generic cholesterol testing. I'm also going to show videos of some of my network pals, Dr. Arthur Agatston, Dr. William Davis MD, maybe Dr. Malcolm Kendrick, and some of their best talks, insightful, and particularly Dr. Agatston. He's the inventor of the Agatston score, the algorithm that interprets the calcium CT scan of the heart, the CAC score, and he's been scanning people for nearly 40 years. Some of his patients, he's still scanning, checking on them, and the first scans he did were 3 decades ago. And the insight in this talk is incredible into how a true expert can basically almost eliminate heart attacks from a patient population that has already had significant heart issues. And it's a combination of mostly real food and reducing insulin resistance, etc., and type 2 diabetes in situ, and all that metabolic stuff is huge. But also he uses pharmaceuticals very selectively in people who have genetic predispositions, and he's going to mention some of them in his talk. But anyway, that's Dr. Agatston, a brilliant cardiologist, best-selling author, and we'll have plenty more talks all during the day, and we're also going to run Q&As. I may get the guys to ring in from the US, though that can be a little tricky at times. In any case, I can run the Q&A and I can come back to people, get their email, and go directly to the guys on very specific questions. So we'll be covered. So a fantastic day, all your testing included. And we're also going to include, perhaps not guaranteed yet, arterial elasticity measurement with a max pulse device. I actually purchased one of them. They're not cheap because they're FDA approved, but we probably have a guy who will be able to come and run this 4-minute short test, which gives insights into the sympathetic, parasympathetic nervous system balance, arterial elasticity, etc. So complementary, if you will, to the kind of hardcore metabolic tests. The tests are all pinprick. There's no blood draws here. It's just GPs just doing the pinprick. That's the beauty of the technology for the lipids and now for the all-important insulin. It's pinprick based. And there's a couple of different types of systems with Metabolic. There's a bench top. We'll have a couple of those machines there. And there's also a cheaper device for consumer, which the guys will have plenty of there. And it's like an LFT, lateral flow. It's like the SARS-CoV-2 test. It just takes a drop of blood and then it's interpreted by a camera, the spectra, to actually get the insulin level. So fantastic technology. The lady who runs the center is fantastic also. Met with her a few days ago. Beautiful area of Ireland, just off the motorway, around a half hour south from South Dublin. So you zip there, and accessible to Wexford and Carlow, Kilkenny and all the surrounding counties. So finally, they're the details, and would really appreciate to help us get this fantastic kind of facility to the people of Ireland, particularly the East Coast, though we are intending, if this works out well, to go around Ireland over the coming months. But if you could share this with your Irish connections, or if you're in Ireland, certainly locally or in your WhatsApp groups, Facebook groups, whatever, we'd really appreciate that, because we want to make this highly successful. We don't settle for less. So thank you, quick one, and thanks for watching.